This was where I was first taught how to inject, on a line that runs from the root of the helix to the alar base. What I figured out, it's not actually the best place to inject. In fact, sometimes you can downgrade your patients by injecting on that line. I've seen this happen on many cases, particularly on training days when the dots are followed very precisely to be near the average spot, but unfortunately what happens is it ends up lowering the position of the cheek. The female cheek is more beautiful when it's elevated and frames the eye, almost echoing the shape of the lateral aspect of the lashes in the shape of the cheek. And this line, being straight, ends up projecting at the wrong point, sometimes even making the cheek look heavier and slightly descended instead of lifting. Instead of following lines, try to find the bone you're actually emulating. If you feel on the shape of the zygoma, there's a greater curvature that is slightly higher often than this line. In Layla's case, it's about here. We also have the junction between the temporal bone and the zygomatic arch, and where those meet, relatively high up, is the widest part on a female face, and it should be projected upwards along a shape that continues from this point. So if I was to elevate her cheek anymore, it'd be better to inject here than here, right on the lateral aspect of the zygoma. This circular shape, it frames the eye underneath, so this means your injection points can run slightly higher up so that you create elevation and femininity rather than a more masculine shaped cheek, which tends to be anteriorly projected with very little laterally.